Jangan lupa like dan subscribe.
We always think about if we're losing weight, you have pain in your tummy, you've had like what we call gastritis or heartburn. Are these all symptoms of something sinister we don't know? Jaundice, if you have cancer of the liver or pancreas. Dysphagia is where you can't swallow. The tumor is causing some blockage. Of course, one thing that we always notice is we lose appetite. You may be losing blood from the tumor. And so if you go to your doctor, you find that your blood count's low. There's lots of reasons. And one of the questions is whether it's due to some underlying growth. Vomiting, if it's something to the stomach, and more importantly, why are you losing weight? Is it because you're dieting, which is fine? If you're exercising, that's fine. But if you can't explain why you're losing weight, this is very of a concern for the stomach and liver. So we go on to the lower tracts, such as the colon. These are slightly different, but still, as I mentioned before, the symptoms can be very mild. So you have bloating, pain. More importantly, if you change of bowel habit, if your bowels that you normally pass motion once a day and suddenly you become having diarrhea, or suddenly you go once every 5 days, or you have blood in your stools, or even if you feel that you go to the toilet, you can't empty your bowels. These are all worrying symptoms. Weight loss, feeling well, blood loss, and you've got bloating, the blockage that happens. So although I gave you all these symptoms, the main thing you really have to bear in
Pastikan
mind is
perjalanan
that
medismu
sometimes
tanpa
you may
repot
not have
bersama
any
Somek.
symptoms at all.
Banyaknya syarat untuk berobat ke Singapura ataupun Malaysia membuat repot selama pandemi ini. Selama 12 tahun, Somek didukung SOS Ambulans Udara melayani pasien untuk berobat ke Singapura dan Malaysia. Somek mencarikan dokter spesialis sesuai dengan keluhan kamu. Somek juga akan membantu proses perizinan ke Singapura dan Malaysia. So, tunggu apa lagi? Hubungi tim Somek untuk perjalanan medismu.
Okay. So why would anyone develop cancer? That's one question that you will ask yourself. Why me? Why who? And who's going to develop it? Well, okay, can be divided in two things. Okay, preventable. That means whatever happens, we can prevent it. Or non-preventable, where it's me, it's my genetics, it's there. So what are these things? Well, if you look at non-preventable, so people who have a previous surgery of cancer or family history or certain races will be prone more to develop any of the cancers in the stomach or colon. So this is something you really have to bear in mind. It's something you can't alter, you can't prevent. So you just have to be extra vigilant and be aware that it may occur. Other things, as again, if it's genetical, if certain conditions such as polyposis, which runs in the family. You may have also heard of Crohn's disease, which is a condition of the bowel. So in these kind of things, they do run a slight risk, about 5 to 10% risk of developing colon cancer as well. So in these people, we have to be very careful. Recurrent pancreatitis or ulcers in the stomach, again, these are things that we have to really bear in mind. For those who are working in the industry, such as asbestos and radiation, of course, these will increase risks. All these, as we said, are non-preventable. We can't do anything about it. What we have to do is be a little bit more aware of our risk. So what's the preventable factors? That's the most important thing. Is really, we know that you don't exercise, you do very little work, walking things, your risk of cancer increases. This is something that you can alter. Your diet plays a huge important factor in your life, and that also increases your risk depending on what you eat. And we'll run through that later in the talk and what's the root problem. And of course, We already know that within our society, what we eat and all the things that we order online, the number of preservatives and salt, because we need to maintain the integrity of the food. So things that are high in preservative, high salt intake will increase. We know the risk of cancers greatly increase. Smoking, alcohol, and extreme obesity, and we know this is a problem, being overweight. Is becoming more and more endemic as we have more, society becomes richer, we have more food, and we do less exercise, and these are main problem. So this last bit is very what we call preventable. We can deal with it. We can reduce